Hello class, I am Veena from George Mason University, and today I am going to teach likelihood ratio as a part of the Teach 1 assignment of the coursework Statistical Process Control. Likelihood ratio is the likelihood that the given test result would be expected in a patient with the target disorder compared to the likelihood that the same result would be expected in a patient without the target disorder. For example, consider two patients and two medical conditions, namely diabetes and common headache. The likelihood of the patient to have weight gain can be closely associated with the patient having diabetes rather than the common headache. Likelihood ratio can be closely associated with sensitivity and specificity. Although these are statistical terms, but in medical diagnosis, sensitivity means the ability to correctly identify those with the disease, and it is a true positive rate. And the specificity is the ability of a test to correctly identify those without the disease, and it is a true negative rate. Likelihood ratios are used to assess two things: the potential utility of a particular diagnostic test and how likely it is that the patient has a disease or a condition. In other words, basically it is a ratio of the probability of the test result to be correct to the probability of the test result to be incorrect. A positive likelihood ratio is equivalent to sensitivity divided by 1 minus specificity, whereas a negative likelihood ratio is equivalent to 1 minus sensitivity divided by specificity. Likelihood ratios range from 0 to infinity, and it depends on number of patient, common diagnosis and medical conditions related to it. Higher the value, the more likely the patient has the condition. For example, consider a likelihood ratio of 9.2. It means that it is 9.2 times more likely to happen in a patient with the condition than without the condition. Here is an example of a likelihood chart. This is a diagnosis of urinary tract infection in children under 5 years conducted using deep test instead of culture. You can see the various criteria in the chart. It says the pre-test probability and post-test probability, and the likelihood ratio lies in between the pre-test and the post-test probability, and it has different criteria like glucose positive, puria and bacteria positive, Le and nitrite positive, Le or nitrate positive, puria and bacteria positive, and you can see all the negatives for the same criteria. For example, the condition of the glucose positive is around 100 in the likelihood ratio, whereas the glucose negative is 0.056. So it means we can deduce that the likelihood ratio of glucose positive in urinary tract infection is more than the glucose negative. And there are many limitations of likelihood ratio in the current medical diagnosis scenario, but two of the most identified are the accuracy dependence on the quality and relevance on the studies generating numbers, and it also demands we consider one element at a time, whereas pattern recognition plays a vital role in medical diagnosis. This is the end of the Teach 1 presentation, and you can find references in the last slide uploaded from the course website. Hope you all enjoyed my video. Thank you.